No idea what prognosis is.
Prognosis? I've never heard of prognosis.
Prognosis means the diagnosis or the outcome, I think. I'm not really sure now.
Chronic condition, isn't that when you have like a real chronic like pain, like severe condition?
Chronic condition. It's where something's severe.
Doctors and pharmacists use really confusing words. They're too long and big.
I went to a doctor to talk about my back pain. He said something about tendons and stuff ripped on my back, and I didn't know what he was talking about.
And had to pull up my own consultant recently for his lack of ability to explain in clear language, not infantile language because I have some intelligence, but clear language about what exactly they're on about. So I would say it's one of the biggest failings the profession have, both pharmacists and medical people.
Healthcare systems are getting more complex. Greater demands are being placed on people to manage their health and well-being. More people are living with chronic illness, which calls for a greater degree of self-management. In Ireland, where 1 in 4 adults have weak literacy skills, health literacy is a real issue. Being health literate is more than being accurately informed about health. It involves having the skills to read and understand everyday health messages, understand numerical concepts such as quantities, frequencies, percentages, and risk, communicate and describe symptoms and experience, to ask questions and to seek clarification. All these skills work together to help us make decisions about our health and well-being, as well as those we care for. People with low health literacy are less likely to know about their illnesses or their medicine, less able to follow treatments, lack the skills needed to access and negotiate the healthcare system. Health literacy skills are important for everyone seeking to improve and manage their health and well-being. This is particularly relevant for people with chronic illness, bringing up children, or caring for others.
I felt weak literacy skills affected my healthcare experience because it was very daunting attending a doctor or attending the hospital with my children. I felt I got my husband to do it as much as possible. It was just an experience that I tried to avoid as much as possible. The coping strategies I'd use would be to ask maybe a dozen questions to find out exactly what they're trying to explain to me, and in turn making me feel very inadequate as a parent. There would be one experience which I recall. My eldest son obviously was in Harcourt Street, and his problem was that he had reflux of the kidney. I had to actually come home myself and get a book from the library to read up on it, to educate myself. What is this? And you know, it's very daunting when they don't fully explain it to you that you understand it, and it's very frightening then to come home and have to read in the book and say, well look, this is what it is, this is serious.
Research in 2008 shows that 6 out of 10 people are unable to define the word prognosis. 2 out of 10 people could not identify which part of the body the cardiology department was for. 1 out of 10 people took the wrong dosage of medicine because they did not fully understand the directions. Addressing the problem of health literacy could save the Irish healthcare system millions of euro by reducing potential medication errors, increasing patient compliance with treatment programs leading to less GP visits and shorter hospital stays, increasing the number of informed patients who actively participate in managing chronic illness.
I suppose for me, growing up, I was lucky enough I never had to deal with health issues, even though I had literacy difficulties growing up. It was when I got married and had children. We had our son, he was 7. I remember one morning he woke up and he couldn't walk, and we rushed him into Tullamore Hospital, and they said he had slipped the pivotous. I was lucky, I suppose my wife was educated, but for me, I couldn't ask questions because I didn't understand. I couldn't talk the language of the doctor. He was talking language that was way above me, I felt. They'd give you a form to sign, but I'd always make sure, you know, that either when the kids were younger, you might take one of the kids with you or something, and they'd distract you, and you'd say, look, I'm trying to cope with the child here, and you get over it that way. But you're trying to be 3 or 4 steps ahead all the time, you know, not to get caught in that position.
It is important for everyone working in healthcare to understand health literacy. There is a language to healthcare which is not part of many people's everyday life. People seeking healthcare information are not familiar with this language. In general, people only seek health information when they need it, and it is often when they are already ill or experiencing a stressful situation. Health professionals can make small changes that will make it easier for everyone.
Well, I first became aware of health literacy really when I trained as a literacy tutor about 10 years ago with Dublin VC on a literacy scheme. Initially I worked with people on a one-to-one basis, helping them with reading and writing basic reading and writing skills. And then as a result of that I went on to study adult education in UCD, which really is invaluable, has been invaluable to me in my work here as a community dietitian. I mean, apart from there is the very obvious fact that if people can't read and write, certainly read, a lot of our material is written, so it may be very difficult for them to understand the basic information we're trying to impart to them. I wasn't really made aware of health literacy as such when I trained, which was a good few years ago, but that has changed a lot now, and people, there is literacy awareness training available to staff, and people are much more aware of it as an issue, I think. The approach that I take now is that we have a lot of our leaflets, we have two versions of them. We would have the very detailed version of leaflets and booklets, and then we have the more basic leaflets that we can start off with that have a lot of visuals in them and that are very, very clear. We have a tool, a visual tool that we can use as a virtual supermarket tour, so we can use it in a clinic situation.
I first became aware of health literacy when I worked for a time as a paediatric nurse, but I have to say it was a very limited awareness at that time. Working with families who had children with chronic illness and would be taking them home and have to give treatments at home, it was very obvious that for parents who had poor spoken English skills, that difficulties would be there for them. But I would never have thought that families that had good spoken English would have experienced similar difficulties. And it was only really when I moved to work in consumer information out in the community that I became aware of the broader issues around literacy and how it impacted on people's health and well-being. Literacy skills such as reading, writing and dealing with numbers are essential for managing your health and well-being. But what's more important, I think, is the confidence, being comfortable with reading, writing and numeracy skills give people when they're going to find out new information or to ask about services. People run into trouble with in healthcare settings in many areas. Some of them seem very simple. For some people, dealing with application forms is difficult. They may not say to you that they have reading or writing difficulties, but will often be embarrassed, so may say, "I'm sorry, I can't fill it out. Will you help me fill it out? I've forgotten my glasses." Or can I take it away with me to fill it out, and they'll get somebody at home to fill in all the answers for them. I think being literacy aware has made me change a lot of my day-to-day practices. I work quite a lot with written information, producing leaflets and booklets, and I'm very conscious of using the plain English NALA guidelines.
Maybe if the healthcare system, maybe if they train their staff to be more aware when somebody comes in.
The change I'd like to see in the health system support people with weak literacy would be better communication, less medical terms and more simple English that we as people can understand.
Especially this day and age, any pain and ache could lead to anything. And that's, I say, multiplied by 10 when you have literacy difficulties.
Use the literacy audit for healthcare settings developed with the National Adult Literacy Agency, which helps us look at the environment and identify what changes we can make to improve it, to make it more accessible and to improve our clients' and patients' experience of our service.
Health literacy is an important issue for all in healthcare, and it is an issue we can do something about. A health literacy audit is available to help you assess how literacy-friendly your place of work is at www.hse.ie. You can contact NALA or visit the website healthcareliteracy.ie for more information on literacy issues.